Imagine receiving a cancer diagnosis. You leave the hospital, open ChatGPT, upload your medical report, and start asking questions. For millions of people around the world, this is no longer a hypothetical situation. It is already happening. Artificial intelligence tools such as ChatGPT, Claude, and Gemini are increasingly being used by cancer patients to understand medical reports, treatment options, and complex terminology. In many ways, this has been a positive development. Patients are becoming more informed. They ask better questions. They understand their condition more clearly. And they often arrive at consultations better prepared than ever before. But doctors are now raising an important concern. Some patients are beginning to trust AI-generated advice more than professional medical guidance. And in certain cases, that trust may be delaying treatment. The problem is that cancer treatment is highly personalized. Two patients may have the same type of cancer, the same symptoms, even similar scans, yet receive completely different treatment plans. Why? Because treatment decisions depend on many factors, including age, disease stage, genetic mutations, overall health, current medications, and individual circumstances. AI does not have access to the complete clinical picture. And before we continue, if you enjoy clear and reliable explanations of science, technology, economics, and current affairs, make sure to subscribe to the channel. We regularly bring important facts, expert insights, and key developments that matter. Doctors report situations where patients spend weeks seeking answers from AI instead of consulting specialists. Others read about treatment side effects online and become so fearful that they postpone or reject recommended therapies. The danger is not always wrong information. Sometimes the danger is incomplete information. AI can explain a pathology report. It can summarize medical research. It can translate complex medical language into simple terms. But it cannot perform a physical examination. It cannot assess subtle clinical signs. And it cannot take responsibility for life and death medical decisions. There is another challenge. Experts call it AI hallucination. This happens when AI confidently generates information that is inaccurate, incomplete, or unsupported by evidence. In healthcare, even a small error can have serious consequences. A delayed diagnosis, a skipped test, or a postponed treatment. None of this means AI is harmful. In fact, many doctors acknowledge that AI is improving health literacy and helping patients participate more actively in their care. The key lesson is simple. AI should function as a medical assistant, not a medical decision maker. AI for information, doctors for decisions. As countries like India rapidly expand digital health services and AI-powered healthcare tools, finding the right